The situation at home, according to health officials in this country, the risk remains low still, even though the number of Canadian cases continues to climb. We are now talking about 67 presumed and confirmed cases, and there are cases that are presumptive in Alberta and Quebec, including another possible infection in the Greater Toronto area that we're hearing of in the overnight hours. All of those presumptive tests gone off to the National Microbiology Lab in Winnipeg for final confirmation. But Michael Serapio is taking a look at the national picture as we begin the week, Michael, and as we go province by province, how are things looking?
Well, let's begin with the largest number to date, province by province. Of course, we're talking about Ontario right now. Take a look at the numbers as they stand. Again, confirmed and presumptive here, Heather. Ontario now having 32 cases of COVID-19, British Columbia 27, Alberta 4, Quebec 4, and again, some of these are presumptive cases that need the confirmation from the National Microbiology Lab. Now, in Ontario, the latest announced just last night with one woman traveling to Colorado, another who had traveled to France, a man who had just returned from Washington, D.C., all those three in self-isolation. Also, a late announcement in Peel Region just outside Toronto, a man identified as having traveled to Germany. Now, BC has the highest number of confirmed cases, now standing at 27, some from a long-term care facility. 2 cases, a man and a woman, who are now both self-isolating, who had been on the Grand Princess cruise ship. Now, interesting about that man, now he is believed to also be the link for a presumptive case in Alberta, an Edmonton area male who had traveled to Ohio, Illinois, and Michigan. He'd also been traveling with that man from BC. So if the Alberta case is confirmed, well, it would be the first time that officials have detected an interprovincial transmission since the arrival of COVID-19 to Canada, Heather. But those are the numbers, again, confirmed and presumptive so far this morning.
Come back to BC, if you would, for a moment, Michael. That care facility where they have reported an outbreak. This is a big concern for officials. And what are we hearing in terms of the vulnerability of the seniors in that facility, but also in the countless other homes across the country?
And you're right. And that's why this one's being watched very closely right across the country, because you're talking about patients that could be very much at risk, are very much at risk. Now, that BC outbreak, if we take a look at it right now, that's taking place at the Lynn Valley Care Centre. This is in North Vancouver. It's a home to more than 200 seniors, many with chronic illnesses, many already considered frail. And that really is the patient profile that would be less able to fend off the virus that leads to COVID-19. And remember, just across the border in Washington State, that Seattle area nursing home reporting 16 deaths already due to COVID-19, and nearly 40% of the care facility's 180 employees have also contracted the disease. So that is why patients' families in BC, while they're still being allowed to help with their loved ones, are also being told to exercise caution. Take a listen to one woman whose 94-year-old mother is in that BC facility.
Families, I think, need to step up a bit and come in. We're meant to come and visit our people, go in and visit our loved one, help them get fed and washed and whatever we can do to help, and then leave again and not interact with other clients and patients.
So again, the patient profile, not great in terms of fighting the virus that leads to COVID-19. And bear in mind, Heather, 7% of this country's senior citizens live in care facilities, which is why they are watching this very intently, very closely, worried about what it could mean if it happens in another part of this country.